Now, the new coronavirus variant has emerged as the United States is grappling with a nationwide spike in infections that has added more than 1 million new cases in just 6 days, according to the Reuters tally, a total of more than 18 million since the pandemic began. Many U.S. states and cities have imposed lockdowns and business closures to try and get a handle on the wave of illnesses driven by last month's Thanksgiving gatherings. Political leaders have asked Americans to stay home for the upcoming holidays to prevent a surge upon the surge threatening to overwhelm the healthcare systems. Meanwhile, the Center for Disease Control in the U.S. has said that this new strain of coronavirus may already be there circulating in the United States. And Joe Biden has said that more challenges are there ahead. Well, to talk more about the situation in the United States, we're joined by Dr. Amitesh Anand, microbiologist, University of California, San Diego. Thank you so much, Doctor, for joining us. Now, the Center for Disease Control has warned that the UK strain may already be circulating in the United States undetected. What are the fears around that? Because so far the US has not been one of the countries that has banned flights from the UK.
I think US has never done good in terms of COVID-19 control. So even this new variant that has come into the country, I don't think there is going to be any difference in terms of what all measures the country is taking. And they are not right now banning any travel or anything. But what many states have done is that we are in stay-at-home order. At least, I'm in California here, we have to be in the state, and if we are traveling from outside the state, then we have to undergo 14 days of quarantine, and we have to go and get tested for COVID.
And, the vaccination procedure is underway in the U.S. In fact, you have 2 vaccines, Moderna and Pfizer. Now, people, however, in the U.S. are hesitant about the vaccine. You have big celebrities taking vaccinations. The doctors have been tweeting their pictures. And is all of this effort making any difference?
Well, so there are 2 things. One is that I'll say people in the US are no different from people anywhere else. Everyone has a little bit of apprehension about these vaccines, especially because they think this vaccine has been developed in a very short span. So I don't know how safe it is. But the good thing is that we have safety data and everything, which indicates that it's really a good vaccine. Having said that, yes, there is a small group of people who are not very much into vaccine, and they are a little reluctant, and they are becoming vocal also about not taking vaccine. But as you know, like President-elect Joe Biden, Dr. Fauci, who is kind of a voice in US for coronavirus control, so they are taking this vaccine, and many other celebrities have taken the vaccine, and that is really sending a positive message to entire population.
And Doctor, also, recently the U.S. added 1 million cases in just a matter of under a week, in around 6 days. What is the main reason that you're seeing such a massive spike in the numbers, given what we already know about how to control the spread of the disease?
I think one problem that has happened is that after about 8-9 months, people have kind of become reluctant towards all the measures that they have to take. Having said that, majority of the population is taking all the precautions, like they are wearing masks, they are maintaining the distance. One reason why we see those large number of cases in US is that in US, testing has become very convenient, and you can just walk to the store and get tested for free of cost. So testing is one reason why we see lots of cases over here. I'm not saying that it's a good thing, it's a bad thing, but then I'll again say that other countries probably are not doing equally well in terms of testing. If they do so, they will also have similar proportion of this virus, because by now this virus has penetrated within the population.
And most worrying is the situation where you are in California, where the reports that they're even running out of ICUs, and appeals to people to not go and celebrate during Christmas.
Well, yes, you're right. The situation is really bad. Most of the hospitals are on the verge of saturation, by which I mean that I think almost 80 to 90% of the hospital space or the number of beds are already occupied. So if things go worse from here, then situation will be really critical. And in terms of California measures, we are under stay-at-home order. we have to avoid traveling out of the state. And obviously, all the necessary measures like wearing masks and everything is being enforced very strictly.
All right, Dr. Amitesh, thank you so much for speaking to us here at NDTV.